Hi, I'm Dr. Jennifer Gaudiani. Tonight I'm going to continue reading to you from my book, Sick Enough. I am doing a series where I'm reading from the boxes at the end of each chapter so that I can share a little piece of something from my heart with you. I invite you in this moment, in this wild time we're in, to settle in, to take some deep breaths, maybe to begin your snack or meal with my company, and I hope you enjoy this next box. This box is called The House on Fire, also known as Combating I'm Fine, and it's found in the end of the chapter going into hibernation. Very often, you're going to hear my dog running around. It's nice. It's really homegrown around here. Hi. You're a good dog. Very often, patients will try and convince me that they are actually fine. I view the word fine as the four-letter F word of our field. They feel they're not sick enough for a higher level of care, to eat the full meal plan their dietitian has prescribed them, to warrant my concern, or to change anything they're doing in their disorder, etc. They say, but Dr. G, I get a 4.0, / I'm a star employee, / I can still run every day, / I'm a good mom, my potassium is normal, my weight is normal, I'm fine. This line of reasoning can sound convincing. An eating disorder will passionately defend itself. Like an abusive partner, it can push all other close connections away. When anything threatens it, it will lash out and become remarkably cruel to the person threatening it, the therapist, the parent, the partner, and even meaner to the patient. Eating disorders scathingly whisper that patients are nothing without their eating disorder. What's so hard about eating disorders is that patients retain their intellectual capacity and many aspects of their emotional capacity. We'd never urge someone with schizophrenia in the midst of a psychotic episode, use your inner wisdom here. Are there really little green men in the room? The psychotic person can't access the real world. The little green men are their reality. We all have to keep in mind that for someone with anorexia nervosa, the beliefs that food and rest will cause devastating harm to their bodies and their perception that their bodies are wretchedly inadequate and revolting are their reality as well. And yet reminding patients to access their inner wisdom is a key element nearly every practitioner uses in their treatment of anorexia nervosa. Where the person with schizophrenia is fully incapacitated during a psychotic episode, the patient with anorexia can competently navigate the rest of the world, at least initially. I should point out this is at the end of a chapter on anorexia nervosa. This bizarre fact easily leads family members and friends to misjudge the severity and cruelty of this mental illness. To combat the delusion that a patient is fine, I use a metaphorical story called The House on Fire. And I will just say parenthetically that this of course applies to all eating disorders, not just to anorexia nervosa. Imagine that a young woman is standing outside her burning house and the fire department rushes up. The firefighter jumps out and says, "We're here to put out your fire." She says, "What fire?" He looks concerned and says, "Well, your fire. I smell the smoke. I feel the heat. I see the flames." She smiles and says, "Oh no. If my house were on fire, it would be so hot that my sidewalk would be bubbling. And because my sidewalk isn't bubbling, I couldn't possibly have a house fire." The firefighters understand her to be mentally ill and they go put out her fire. I go on to remind my patients that there is no single marker of illness that I look at to determine whether they are sick enough to proceed with recovery efforts. Saying my blood work is fine is like saying my sidewalk's not bubbling. This is an extremely important point because someone who is fine can comfortably reject what all those people are telling them about how concerned they are and can proceed with restricting an exercise. The concept of fine stalls recoveries. I try to introduce these concepts the first time I hear my patient trying to convince me how fine they are, so that the next time it happens, I can simply say in shorthand and with kindness, "House on fire." I remind them of all the objective evidence of hibernation physiology that they possess, medical signs that they aren't fine at all. Thank you so much for joining me today. Please take good care of yourself. Today is a new day. You can use this opportunity to say, if it was tough so far, I'm really going to redouble my self-care and recovery efforts. Take care, and I'll see you next time.